Good morning and welcome to today's panel discussion where we'll explore the future of healthcare through the lens of innovation, efficiency and patient-centric solutions. We're navigating the evolving landscape of digital health, and one of the most pressing questions that we face is what is a truly connected healthcare ecosystem? Before I really get into the content and introduce our guest today, just a couple of housekeeping matters. You'll see in the taskbar of the GoToMeeting a couple of features. One is the ability or an icon that represents the ability to ask a question. We want to keep this interactive, but we'd ask that if you have questions, please can you submit them through that icon. And secondly, during the presentation today, we will be running a couple of polls to get feedback on where you are in your digital health journey, and what is really of interest to you in the future. All of those activities will happen during the presentation, so please respond and we will share the results afterwards. And any questions we don't answer today, we will share to all those registered in a feedback email afterwards. In Australia, we're pushing towards a more connected and digitally enabled healthcare system, and that offers the promise of enhanced patient experience and improved health outcomes. We've seen a real advance in establishing a digital health infrastructure with initiatives like My Health Record and the provider Connect Australia, laying the groundwork for us to share information and be more coordinated, especially in care models. And we saw a significant shift with the rapid adoption of telehealth during COVID-19, which showed that we can improve access and efficiency, particularly for those who are really underserviced or remote, an important factor in Australian healthcare. Many of our healthcare providers and hospitals are now entering their second generation of EMR use, and they're evolving their use cases and in some cases changing their scope or even changing their platform. So to achieve a truly connected healthcare ecosystem, we have to go beyond just implementing technology. We need a holistic approach that addresses key challenges like interoperability, cybersecurity, digital health literacy, and transactional standards that enable us to share information across institutions. Anyone who manages information in healthcare knows cybersecurity is a real growing concern, and digitization of health services requires robust measures to protect sensitive patient information, both legally but also ethically. Additionally, digital health literacy disparities must be tackled to ensure that all Australians can benefit from the advancements that we're making in healthcare technology. At the forefront of this is the people who are providing clinical care. There's increased pressure, workload, pressure on staff levels, staff safety, and productivity demands, which are growing on a daily basis. The need to deliver the right information to the right person at the right time in the right place has never been so important. The transformation to the flexibility of a mobile working environment, which can unlock some of this productivity, and we've experienced that in our personal lives, is not always easy to recreate in the clinical environment, where there's significant concerns about the things I just mentioned: privacy, security, cost, interoperability, or loss of functionality. So what's possible if we really create a truly connected ecosystem? Today, I'm really fortunate to be joined by a few great guests, and you'll see them on screen. Brad Gwyther, who's the Principal Professional Services Consultant from Imprivata, and they really specialise in managing digital identities in life-critical environments like ours. Andrew Duncan, VP of Product and Marketing at SpectraLink, who'll be able to add a real perspective around mobility in an enterprise environment and what that means. And Michael Dyson, VP of Sales and Marketing for SOTI, who bring a fantastic perspective on managing the complexity of IoT environments. I'm going to ask these guests to share their insights on what it means to build a truly connected healthcare ecosystem, not just from their own organisation's perspective, but looking across the entire world that we operate in. One that leverages cutting-edge technology, but also centres on the needs of patients, ensuring that the system is both accessible and secure for everyone. So I'm going to begin by asking Brad, what's the focus of Imprivata within the connected healthcare ecosystem?
Good morning. Thanks, Mark, for having me. I guess for me, it's all about the customer experience and the benefits that we provide when using not just Imprivata solutions, but our partner solutions. And obviously, it would be remiss of me not to mention our mission to deliver simple and secure access through the strategic use of digital identity, as you mentioned before. So having a user be able to access a mobile device, an endpoint, and get access to their applications and data, not just quickly, but also securely as well. Typically, though, before we implement anything, it's understanding what the problems might be or the workflows with our clinical staff, and also how the patient is affected in their view of the world as well. So what are the current workflows that are in use? What are the patients doing? How does that affect them? Is it a timely issue? Is it a security issue? And then through the use of our solutions and partner solutions, delivering that quick access to things and making sure that people can access the data on time and at the right, the right credentials, etc.
You mentioned the benefits from implementing a solution which unlocks the access and the consistency across the organisation. Can you share a bit more about what that means from a patient and also from a healthcare organisation perspective?
Sure. I guess with a lot of security having a very heavy weighting these days in terms of access and having longer complex passwords, having strong authentication, we want to streamline that access for our clinical staff. So when you're using a shared mobile device, for example, not having to enter long complex passwords a lot of the time. So being able to pick up a simple device, tap on with a card, for example, maybe use a PIN to access that device and a shared device, it gives you quicker access, which means that then when you're caring for a patient, the clinical staff can get to the record faster, again, more securely and efficiently. And it means then if you're trying to roll out new medical systems, applications, EMRs, EHRs, etc., the adoption's a lot more quick, it's a lot faster, it's easier to use, etc., which means quicker time to value. So if you're having to wait around for a device and or use it as somebody else, that's not a good thing from a clinical side of things. So we want to make sure that solutions in use with our products and partners, easy to adopt, easy to use, which then reduce the cost of the business for one, training. You get better upstream reporting of who's using what, where, and when. And from an analytics side of things, you can then make better decision making from looking at who's using what, where, and when, and make sure that things from a clinical side of things are reducing risk as well.
I guess that applies to environments like virtual care as well.
Yeah, definitely. I guess from our view of the world, digital is the virtual care is the digital front door. So how do I get into a system? How do I access something? Making sure that you're using the right credentials, etc., and not sharing accounts. So yeah, looking at, I guess, that identity of where I'm using things, whether it's internally from home, what device I'm using, and looking at the password complexity side of things is a big thing these days with having 25 character plus passphrases, reducing the use of that, but still having strong authentication is quite key as well.
Fantastic. I think a lot of people on the call today will be looking at what's happening right now, but they'll be really curious about what the trends and themes that we're seeing emerging and what they should be thinking about into the future. Can you share a bit about what your thoughts are and on where things may be going as we advance into this ecosystem landscape?
Yeah, from a future side of things, there's lots of things around we can do from a refinement and expansion side of things with our solutions, working with our customers, working with our current vendors as well, and expanding our reference architecture, with, I guess, statewide and also national standards continually evolving every year. We're looking at public healthcare with the 10 to 25 points that digital needs to, health needs to implement, looking at how we align to those references and those technology requirements as well, particularly, as I mentioned before, security and access playing a modern part in access management and reporting as well. So making sure that we tick those points off, not just as a company, but working with our partners and our references as well.
Fantastic.
And probably the big thing as well, is the customer experience. That's, again, the big focus of Improvider, is making sure that if we're implementing a product, that it works, or a solution that is as well, that it works and you get the value from your investment. And that's a big key point that Improvider focuses on from an experience point of view.
And maybe if I could just ask you to share a little around the themes and trends that you're seeing today as you engage with different groups across the country and perhaps across different areas of the healthcare ecosystem.
Yeah, sure. I guess if we go back a few years, it was a computer. I log in and I leave it open all the time. I guess that's the the first stage of things, EMRs from a phase one were rolled out in a lot of digital health and corporate organisations throughout Australia and New Zealand and across the world. That's matured a lot now. So we're looking at that phase two of an EMR. What does that provide? We have lots of data. As I mentioned a few times, data is beautiful. We have all these data points that we can report on. But are we getting the most of it? Are we doing the right thing? What are the efficiencies we can get from our EMRs and our applications? But then how does it affect that from a clinical experience or a patient journey? All of us are a patient. When I go to the GP, I get asked a whole bunch of questions. So I fill out those things, that gets reported to the GP. He has a look at it. From there, I might need a referral. So how does that work from a referral point of view to, getting access to my mobile device? I go see a medical imaging person and I've got a referral there. So, reducing that paper side of things. So that connected world around experience from a just clinical side, but when I'm a patient from external, getting admitted somewhere, etc. I guess that's the next step of that interoperability, as you mentioned before, around those data points and how they're used and reported on, and making that journey a lot more efficient and secure as well.
Thanks so much, Brad. Yeah, I think the themes there around security, interoperability, and that connected world where everything works together is probably something that everyone can definitely resonate with. I might throw to Andrew now, if that's okay, and just ask Andrew, could you share with us what's the focus of SpectraLink in this connected healthcare ecosystem?
Definitely. So, from a SpectraLink perspective, our focus is really in bringing people together, whether that's nurses talking to other nurses, nurses being able to communicate with doctors, being able to communicate with patients through nurse call applications, or even nurses being able to connect to the right data at the right time. So, our devices really are that bridge to allow people to connect with one another there. We've got 30 years experience in bringing together devices aimed at the healthcare market, making sure that they're going to bring together a solid value proposition for the hospitals, making sure that they were testing and validating solutions or that bring all of these pieces of information. We mentioned EHRs, we have location data, we have applications, we have single sign-on capabilities. All of that has to come together through the device and be reflected back to the nurse and allow them to talk to one another, communicate, and have access to the right information at the right time.
And the benefits for organisations, I guess, you've spoken a little bit about them, but
Yep.
perhaps you could maybe dig into a bit about what that means for the organisations that we're delivering to.
Sure. Yeah. So having that information in the right hands at the right people at the right time minimizes mistakes, allows better collaboration, reduces fatigue when people aren't repeating their story, when they're not making those mistakes and having to go back and redo things. So all of that comes together to really help an organization. In addition to that, lower TCO, right? With the device deployments, customers are spending a significant amount of money in order to deploy connected health ecosystems across their facilities, and they need to make sure that what they buy are going to be long lasting, are going to be durable, are going to meet the needs for many years into the future.
I think probably a lot of the people on the call would definitely resonate with the experience of fatigue within organisations, and certainly the pressures on the total cost of ownership, 100%. So I asked Brad about some of the trends and themes that he sees emerging, and obviously you're looking globally from your position. Can you share a little bit about what you're seeing in that regard?
Yeah, absolutely. So, some of the things that we see companies focused on, customers in the space focused on, is risk reduction, right? As they consider doing a health ecosystem, bringing connected health into their organization, making sure that people have the access to the data, they don't want unproven solutions. So they're really looking for validation and testing and certification so that they know when they make a selection of vendors that those pieces are going to work together to get the outcome that they're looking for. So we spend a significant amount of time having to look across all of our technical partners, SOTI and Imprivata being two of those, in order to make sure that we've done that validation and work, that we can give the customers the sense of reduced risk, and that that they'll see the TCO out of their engagement. And then along with that, some of those other themes are, as Brad mentioned, around security, right? That's the other set of partners that we have to work with, is keeping the network secure. There's attacks, cyber attacks across many hospital customers. Our endpoints are within the hospital. We've got to make sure that those remain secure, that we're doing updates to them, keeping them fresh, and that those are connected as well as they're deployed.
Fantastic. Yeah, I think yeah, we heard from Brad about the data is beautiful, and the importance of being able to access that data and really maximize it. And I think we have to couple that with the ability to improve communication. Right, communication is still key. It's still multi-member teams trying to do the best for the patient and trying to help each other. But I guess the other piece that's really emerged, and I'm gonna throw it to Michael Dyson in a moment. But the other piece that's really emerged is that so many more things than just the standard devices that we've been thinking about are now connected. And maybe Michael, I could get you to talk perhaps about what SOTI's focus is within this connected healthcare ecosystem.
Yeah, I think that's a really good point, Mark. And to the other guys' comments, security and customer experience are obviously primary, but that's across a very broad collection of devices and collection of things that are used in hospitals. So we started, with the workstation on wheels and the Windows PC sitting there, the handheld device, all of those things used in hospitals, but it's also printers and other connected devices, kiosks. All of those things are attached to the hospital's network. All of those things have an IP address, and all of those things are exposed from a security perspective. So each and every one of them has to be managed. They have to be secured in the first instance, so that the organisation, the hospital, and the patient can be confident that their data is secure. But also, they then have to be able to have a great customer experience. Nothing worse than if you give someone a piece of technology and it takes forever to log into it, or it's difficult to support, or they have a problem and you can't help them. And that's where we see our role, which is as an enabler to have great devices and great technologies work well, be easily deployable, easily supportable, easily managed, and probably most importantly, secured.
Yeah, that's obviously probably a big factor for particularly those working in security within the IT organisations within hospitals. It's every one of those devices is potentially a point of needing management, and also a point of wanting to make sure that you can't access any or gain access to any information that you shouldn't through those. The benefits for organisations in kind of rolling out a SOTI type solution. Can you share a little bit about what those are for healthcare organisations?
Yeah, look, there's some really key points, and again, you alluded to the fact that it's a lot of different people in the organisation might be using a bank of devices. For example, it might have a 10 SpectraLink devices as a bank of devices that are accessible to all these different users. Being able to have a shared device experience, as Brad spoke about from the Imprivata point of view, we play a key role in that, in being able to have each person able to access what they should be able to access, where and when they should be able to access that patient data, and restricting others from seeing that. When someone else logs into the device, it's a completely different device. It's secure for them. It provides them the information, and all sorts of different administrative levels are available within our platform to ensure that people can access what they should be able to access, where and when they should be able to access it, and not anything else. So that is a really, really big part of the piece that we play. But I think it's becoming more and more beyond that now, is that we want to have intelligence. You said data is beautiful. It's very true. you've got to also understand how people are using the device, where they're using it, what applications they're using on the device, how it's performing, what impact that's having on the actual productivity within the environment, and making sure that the user information is available again appropriately and securely to the people who need it, regardless of where that user is.
I think I think the broadness of the solution and being able to make sure that that information is accessible is as important as the interoperability piece from a technical perspective. It's about effective use, right?
Oh, 100%. And the last thing the IT department wants, the last thing the people who have to support all of these users with all of these fantastic endpoints want is 16 different systems to go and look at this one and look at this one and fix this problem and fix this over here. They want to have a single pane of glass that they can go to and say, right, I can see our world. I can see all of the devices that are connected, whether the devices are connected in the hospital or, as we're seeing more and more today, healthcare is not just provided in a big white building with inside the four walls. Healthcare is being provided in a mobile sense, in home care by all sorts of organisations, and the critical part of that is being able to have access to the same information, the same user experience, regardless of where people are. You've got to be able to do that, whether you're in the patient's home. You've got to have the right information accessible to you and securely accessible to you, regardless of where it is you're delivering that healthcare. So that is ultimately about patient outcome and ultimately about a better experience, not just for the patient, but for the clinician and for the organisation, because we see people still sharing private patient data on unsecured devices. That is fundamentally wrong. We cannot be sharing private patient data on unsecured or unmanaged devices, and we all know people do in the industry. We have had that conversation at other venues in the past, but it's really not something that's acceptable anymore, and it's not even necessary. It can be managed.
Yeah, I think we'd all agree that securing that data, using it in the right place at the right time, and making it easy for people to access in a secure way is critical to all of us on this call and all of the organisations that we represent also. One of the big trends, I guess, in healthcare at the moment is, and one of the big probably trends in the world at the moment is discussion around AI and the role that it plays. And we have got a question which has come in, which I guess I'll go a little bit off script and we'll throw this question because it'd be fascinating to hear your thoughts, and I think it'd be a lot of interest from those on the call. So the question is, AI holds great promise for improving the delivery of healthcare, and we can probably talk a little bit about that. But what are your thoughts on the ethical issues of deploying AI in healthcare? AI is trained on that large data, that beautiful data we talked about. Is there an insensitivity with AI to the impact on consumers? Maybe Brad, I could start with. Michael,
Sure.
you go ahead.
I was just going to say that I think there's multiple ways to look at AI and the way AI is used. I'll let Brad talk about the patient data side of it because I think that's more, that's another topic. But using AI already to intelligently provide information about the optimal use of a device or the optimal performance or productivity, all of those things, that's already being done. And when we look at things outside of the scope of our area, I suppose, but you look at things, we were talking earlier about echocardiogram devices that are already providing the ability to give better patient data and better patient information quicker using AI. That's already happening. But in our space, I think there's lots of ways that you can use AI, and we already do within our product set, within our capabilities, to be able to deliver information on the way devices are used and do predictive maintenance on devices so that things don't go wrong in the first place and cause downtime. We use AI to do that today.
Yep.
Yep.
Yeah,
Brad,
I'll add to that. It's within that we've got the ability to look at predictive information on how devices are running. We actually use AI in even very innocuous ways you wouldn't even predict, and that's echo suppression, noise cancellation in the background for quieter calls, easier to understand calls, better voice performance. Uh, we have that capability built in our devices today and uses an on-device AI engine. Certainly, as we grow in this connected healthcare space, certainly you're going to run the risk of ethical considerations that were mentioned, trying to figure out how to use AI in clinical diagnoses, things like that. But in the meantime, I think there's a near term path where we'll see AI used to help process large volumes of information and filter down for a provider as to what's important, right? Helping them to sort through the data that they already generate and be able to flag that for entry into medical records, et cetera. It just helps them to be more productive in their day-to-day activities.
Yeah, I think I can echo some of those thoughts as well. From an AI side of things, again, AI is a big topic, but it's also very deep and wide, as you can go a few different directions. But I guess from a data side of things, as Andrew mentioned, customers already have the EMR data and other authentication data, access data, device data that they have. So you can use systems and ingest that data to then look at trending, benchmarking, and then alert outside the normal. That's here, and that's also improving as every day. So some of the key factors from a security point of view, a risk point of view, is having that data and alert outside of the normal. And AI can do that, and machine learning can do that. Either you programming where the goalposts are, or getting that data and then also doing some automatic trending for that. How does that affect the patient side of things and the consumer experience? As Andrew and Michael have mentioned, it's here already. When I'm a patient, when I go to a GP, I get a message on my phone saying, hey, fill out a few details first, and that goes through a process where it can semi-diagnose some things, so then the doctor and the GP makes the call more efficient, and it gives you a call saying you don't need to come in, you've probably just got a cold, or you might have the flu, here's some antibiotics, or take 2 of these and rest for a week. So that's here to stay. It's in the next step of diagnosis and prescribing that. From an ethical point of view, I think we're a little bit off that, but there are solutions out there already that you can ring up and it sounds like a person, but it's a machine you're talking to. So how does that impact? Well, I guess it comes down to what's the clinical risk versus the clinical benefit, and then I guess there's some ethical things that we have lots of, not we, but there are people that have that hat on that talk every day about that side of things. But very, very key topic at the moment. But that consumer experience is here.
I think too, it's undeniable that cost pressures mean that the use of AI can create better services and at lower costs. And we've all got cost pressures, everyone in healthcare and every other industry for that matter. So it's about, can that deliver better patient outcomes with limited resources and limited both financial and human resources that are available? And I'm certain it can. The ethical question's a big one.
Yeah. When we talk about that right data at the right time, it's about, the right data to make a decision as well, right? So narrowing that focus really will help in the efficiency of the people doing their jobs every day.
So AI is obviously the most prevalent sort of conversation just in daily life, let alone within healthcare, which is obviously it's got a significant role to play. And fascinating to hear that all of you have some element of AI within the structures of what you're doing already, which we probably don't even think about and we don't touch every day. Perhaps I could ask each of you in turn just to maybe share AI or non-AI, where you see the innovation or where you see the direction of the industry and your area of the industry going, and what might be on the horizon for people to think about. Brad, if it's okay, I might start with you.
Yeah, sure. Well, Improvisa's recently published our roadmap. We've had roadmaps for many years, but we've now published that publicly. So that makes it easy to see what product features we've released, but also what's coming. So as I mentioned before, it's working with our current partners, our customers especially, and looking at their workflows from a clinical side of things, looking at their solutions and their roadmaps and their pressures, as Michael mentioned, cost and efficiency, to then make sure that our products have the features that customers need and want, but also aligned to pressures from security side of things, government and other health regulations that we need to meet. So I guess from a training point of view, is making our products stronger, making them work more rapidly, and again, just making sure that we make that time to value nice for our customers.
And I guess for end users, trying to create the same experience no matter where they are is a key part of that, right?
Yeah, our customer experience focus is never wavers. So that's the main thing. We'll make sure it works. At the same time, there are back end and technical things we need to make sure that work and align to. But at the end of the day, it's typically a technical and a workflow process that goes in or we're changing to make that clinical experience better. And then upstream reporting and cost analysis, et cetera. But again, it's that customer experience that we focus on, and it's my main role as well.
Beautiful. Thanks, Brad. Andrew, maybe I could ask you the same question, where you see the future, where you see the innovation going.
Yeah, so I think a few things. First off, we see a couple of evolution steps within healthcare. Certainly, there's some trends where connected healthcare is growing outside of just the four walls of a hospital environment. It's beginning to be home health visits. It's connecting doctors to patients even after patients leave the hospital, and we have nurses visiting those patients as well. So being able to expand outside the four walls, being able to leverage other cellular communication technologies is something where we haven't had as much focused in the past, but is going to have to become more and more important. We already mentioned AI. There's going to be more data that devices generate, and the device can have a role in helping to sort through some of that data. And as far as efficiency goes, being a compute device, we can do a lot of that sorting and the AI capabilities on the device without having to send it to the cloud first for analysis there and sending it back. So certainly see an expanded role within AI as we continue to grow. And then certainly for SpectraLink, an ongoing focus in making our devices easier to use, easier to deploy, making them just more accessible to a broader range of users.
Fantastic. Thank you, Andrew. And Michael, I've asked the other two, so I better be fair to you and let you have an answer to this question as well. Could you maybe share your thoughts on the innovation and what the future considerations might be?
Yeah, I think probably in two parts. One is that we are already in the future. We are well and truly trending towards what we're doing. So I think more and more we're going to see a greater focus on having the ability to have the information we need to treat a patient on our person. We're not going to be going back to a workstation at the nurse's station or on a trolley. We're going to have a mobile device in our hand that's able to be used to access that, so that you can spend more time in front of the patient as a nurse or as a clinician. Being able to do that in a very big way is already started, but there's some limitations that some of the systems that people have been using have that have made that not as possible. And I think the more people become aware of the capability of having a proper shared device environment, having that, as I said, experience that's exactly the same regardless of where you are, what location you're in, whether you're in the hospital, whether you're outside the hospital, being able to have that seamless user experience is the trend we're seeing. And we still have a very low adoption rate in ANZ by comparison with the rest of the world. The MRAM, electronic medical record adoption model, would suggest we're well behind, and that's partially because we do not implement the modern technologies we need to implement as well as we might. So I think there's still a big trend in the growth, and if you look at HIMSS MRAM standards, ANZ's still got a fair way to go. The second part of it is that no longer is it just that we're here to get the device out there. We're actually going to be far more about the intelligence that we can glean from using this technology, the intelligence about user behavior, the intelligence about what the results are, outcomes are, safeties, all of those things. We want to be able to get more information from that data that's available, and we want to be able to use it smarter. Yes, AI will play a role in that, but the fact of the matter is the capability to get that intelligent data is there today, but you've got to have the right systems to do it, and the systems that are designed for true mission and business critical mobility. And there's nothing more critical than healthcare in terms of being able to provide a technology that's really designed specifically for that mission and business critical environment. So that's our key focus is growing towards true mobility in healthcare and true user experience that's ubiquitous.
I think that I think the statement around the how do we get that integrated end-to-end healthcare service? There's so much waste. There's so many challenges within it currently, but that's actually how we unlock the value and the power of all the investment that's being made everywhere. I think that's a really critical piece. I guess on that sort of or in that space, perhaps Mike, you can talk a little bit more about what you think the technology we could implement, or what technology we could be thinking about to start to unlock that as perhaps a starting step.
Yeah, sure. I think, again, you take it into all sorts of different industries, and SOTI's been around 30 years and working with many different types of industries. And so I think we can take lessons from other industries that have been driven by the almighty dollar rather than by the clinical outcome, because they will be the first to take the step because they see it will save money. The guys talked about total cost of ownership, or the TCO of an investment in technology. For me, that's not what it's about. It's about the return on investment. If you're not improving the outcome, whether that's financially or whether that's in a clinical sense, if you're not improving the outcome, you won't implement the technology. So looking for technologies that are going to provide a better outcome at a lower cost and have a, not if not immediate, then certainly a very quick return on investment, that's what people want to be doing. And that isn't by thinking in the old ways. That isn't by thinking that everything's a desktop and will behave and treat things like a desktop, because nobody relies on mobility more than they have today. Like today is when everyone's using something in their hand that's basically a computer. So being able to implement that is really, really important. So it's a mindset change from having to go away from the patient to being able to have that in the hand of the patient. I think the technology's there today, but we've got to stop people thinking, I suppose, a little bit in the dark ages from times gone by of the way it was done. And it's dependent upon the age of the cohort. It's difficult to get some people to change the way they've done things, but it's part of the journey, is bringing people on that journey and helping them understand the benefits it will bring to their patients.
Fantastic, thank you.
Yep.
Now, Andrew, I'm going to ask you the same question in a moment, but you'll shortly be getting, I think, a second question in the poll. So if you see that pop up, please feel free to respond. We're really interested in your feedback. Andrew, obviously, SpectraLink is heavily focused on improving that communication piece, but the same question for you. That the technology will enable that end-to-end flow and to really realise some of the benefits of the promise of this technology. How do you see that playing out?
There's a lot wrapped into that, of course, right? So, as we look at our devices, as I mentioned before, we do a lot of testing, certification work, making sure that data and applications from multiple partnerships all work well together on the device and are all enabled for that end user. It's a great thing to see, because that then also becomes a way to bridge between multiple sets of data. So if we actually take the step and go to, for example, location data, right? People can use location data. Where is a device within a hospital? And you can leverage that along with the critical alerts and alarms that are coming up. Are those alerts and alarms going to an entire care team, or are they going to the person that's the closest and can respond? If somebody's taking their lunch break and is across the building in a cafeteria, it's probably not a good idea to send them the alert and alarm. Let's get it to somebody else that's on the right floor that can actually respond. And so looking at those pieces, being able to bridge the roles of users, and stitch these datas together in useful ways is definitely a piece that's going to come very quickly here, completing complete solutions for the customers across multiple applications and multiple technologies.
Thanks so much, Andrew. And Brad, if you could maybe share your view on the same question through your lens. We've got obviously three experts on the panel and all looking at things from different angles. So I'd be really interested to hear your thoughts on this as well.
Yeah, I think total cost of ownership is also a very big point for us, that when you implement any solution, that it's cost effective and those benefits, like Michael said, are there. So anytime you implement something, you need to be measuring what you're doing. I guess that old school view of, we've got a desktop, we've got a server, etc. I'm going to throw in the word cloud. That's also very apparent these days with a lot of cloud first strategies, etc. So looking at what workflows do work in the cloud, what infrastructure you put in the cloud, what applications you put in the cloud is very important as well for that ownership side of things. We see a lot of hybrid environments with on-premise and cloud, and looking at how those solutions work from a management point of view and IT management administration side. So again, trying to reduce that to make it easy. So not just administrative, but also the end user. If I go back to that experience side of things, it's making sure that any device I pick up, I can use my identity, which is another, I guess, key point. My identity, I can access that securely and effectively, and I get access to my patient data, because that's what I need to do as a clinician. I don't care what device it is. I don't care what the policies are. I don't read my notes. I just wanted to get access to what I need to do to treat my patient. So
Great.
that's what the view that we look from, and we're going to make sure that our clinical workflows and analysis aligns to that as well.
Fantastic, thanks, Brad. Look, we're coming to the end of the webinar, and I thought I might just quickly summarise sort of some of the key themes we've talked about today. And as I said, we will share some feedback after the webinar and some information. I think Brad summed it up beautifully in terms of the AI and the bigger piece. That data is beautiful, and there's absolutely opportunity for innovation and for using that data for unlocking some of the power. I think Michael articulated that fantastically. Andrew really drew in that piece around the fact that for all the data and for all the information, that communication, the ability to work cooperatively is still key for delivery of healthcare. And that's where the technology can actually unlock the power of the people within organizations. Brad, I think that last piece actually really resonated with me, is that for an end user, that common experience to be able to pick up a device and have the right information in front of me with the patient when I need it, to be able to make the right decision, or to be able to work with my team to care for a patient, that's actually the key that all of this is unlocking. But I think it would be easy to say that, or easy to see in the conversation we just had, that there's a lot of really clever innovations, some really developed solutions available to enable that to happen. And I guess if you're a clinician, you just want the right information. If you're trying to work out how to get that information there, you need it to be secure, you need it to be progressive, you need it to be looking across that entire ecosystem and all the devices that are connected together. And at the end of the day, it's a complex environment. It's a complex ecosystem. It's all dependent on each other, as all ecosystems are. But for the people that interact with it every day, it's simple, it's consistent, and it's about balancing or creating accessibility while really making sure that accessibility is secure. And as I said, if you take anything away from this webinar today, I would suggest that data is beautiful is probably the quote of the day. So I'm going to keep that with me and try to keep on using it. Thank you to everyone who's attended today and listened to the webinar, and thank you so much to the speakers, our guest speakers today. I really appreciate your time and expertise. As I mentioned, all the questions that we receive will be followed up, and we'll be sharing those back to you. And thank you also to the team, which you don't see on screen at the moment, behind the scenes, who helped us get this up and running. It's been a real pleasure meeting you all today, and enjoy the rest of your day. Thank you so much.